district. Happening around the district is news as edited by Rotary Olalekan Otun. He is the chair public image for Rotary District 9111. Now let's take the headlines first. Rotary Club of Ikoyi Metro commissions healthcare services at General Hospital Odo here in Lagos. District 9111 organizes Peace Summit on the 14th of this month. Also, the Rotary Club of Lekki Golden empowers Ikota community with maternal and child care equipment. Now the news in full.
The Rotary Club of Ikoyi Metropolitan District 9112 commissions a landmark healthcare project at General Hospital, Lagos, reaffirming its commitment to strengthen public health infrastructure in the state. The 150 million intervention executed over 3 years covers the full renovation and equipping of Ward C1 and C2 as well as F1 and F2. The project includes modern toilet facilities, complete electrical rewiring, upgraded plumbing and water system, installation of new doors and aluminum windows, and the provision of hospital beds, mattresses, and essential fittings. The club also improves water supply and treatment system and donates wheelchairs and other critical equipment to enhance patients' care and mobility within the hospital. Speaking at the commission in the district governor of Rotary International District 9112, Rotary Adedoyin, emphasizes continuity, noting that the project is initiated, sustained, and completed under successive administrations, demonstrating Rotary's culture of lasting impact beyond one tenure. A representative of the Lagos State Ministry of Health, Dr. Abiola Mabogunje, Permanent Secretary, Health Service Commission, commends the club for partnering with government to improve healthcare delivery, stating that the project boosts patient capacity, enhances service efficiency, and strengthens working conditions for medical personnel. With the intervention of the Rotary Club of Ikoyi Metro once again, demonstrates service above self.
Now, moving on to the next story, Rotary International District 9111 is set to organize a peace summit on Saturday, the 14th of this month, starting from 10 o'clock in the morning. And it will be held at the Wole Soyinka Cultural Center, Igomu, formerly known as National Theatre, as part of activities of Rotary International President's visit, Rotary Francesco Arizo, his official visit to our dear country Nigeria. According to Rotary International District 911 Governor and Chief Host Prince Henry Akinyele, he said the Peace Summit has its theme as promoting peace and understanding Rotary's role in building a harmonious society. Akinyele disclosed that the Governor of Lagos State, Mr. Babajide Sanwo-Olu, is the special guest of honor. Then the former Federal Minister for Health and the past District Governor, Prince Julius Adelusi Adeluyi, is to deliver the keynote address. In his contribution, the Chairman Peace Institute Committee for the district, Rotary Tunde Olaniyan, added that other speakers are Professor Femi Mimiko, Professor of International Relations from Babafemi Awolowo University, Ile-Ife. He will speak on international leaders' role in conflict resolution and peace building, while the immediate past district governor, Rotary Dr. Oluwole Kukoyi, will also give his own address. Dignitaries expected to grace the occasion at the Peace Summit include the trustee of Rotary Foundation, Rotary Ijeoma Pearl Okoro, District Governor, District 9112, Larry Adedoyin, and past District Governor, as well as Royal Fathers of the Day.
The Rotary Club of Lekki Golden District 912 launches Project Safe Start at Ikota Community, Lekki, Lagos, providing life-saving healthcare services for pregnant women and children. The program promotes maternal wellness, disease prevention, and healthy living among vulnerable populations. In partnership with Bioscience Healthcare, the initiative offers health talks, screening for blood pressure and blood sugar, and aerobic section to encourage physical activity among expectant mothers. Over 100 mosquito nets, 50 sickle cell test kits, and 50 pregnancy test kits are distributed to improve maternal and child health outcome. The club president, Rotary Dr. Christiana Okenla, emphasizes the importance of giving back, saying the initiative supports mothers and children to lead healthier lives. Through Project Safe Start, the Rotary Club of Lekki Golden demonstrates its commitment to community service. And that's all we can take on happenings around the district. Let's interact with the president of Rotary Club of Ikoyi Metropolitan, Rotary Alexander Chukwu, and the past presidents, Rotary Bolao Adeyinka and Kemi Folorunsho. Let's go on a quick break. We'll be right back.
It has to do with us being Rotarians. We are people of action. It all started when I went there to visit my aunt who was sick, and I saw her being laid on the floor because the old bed space has been occupied by patients. There was no space on the bed for her to be admitted to. It actually happened when the lift incident happened at the General Hospital, Odo. So most of the doctors were on strike. Only one doctor was on duty. And at the end of it all, I was so curious and I was worried. I had to check on the locked wards because I saw some of the wards were locked, padlocked somehow. I peeped through it and I saw that they were totally dilapidated and they were not in use. That was what inspired, and that was the first bold step I took back to the club to explain the situation, because it's not going to benefit only my aunts that I saw that day in that situation. It's going to benefit the general public. Yes, that covers a lot about what Rotary International stands for. It covers the 7 areas of focus. We have the prevention of the disease prevention itself. We have the water and sanitation. This will have a great impact because sometimes when you put up some projects and there are no loadable water to work with, and a lot of damages can come from there, a lot of people already are connected to the fact that that place is newly built and is well equipped, and water and sanitation also, which will improve the health of the patients that are on admission at any point in time, is part of their well-being also. On the day of the commissioning, we inducted them community corps. That's people who are, some of them are part of us, they are Rotarians, some of them are healthcare personnel in the hospital. We inducted them as a community corps. They will look into it. They will follow up on whatsoever needed to be done as per time, and then they will come back to the club to relate to it, because some of them, like I said, are Rotarians. So there's going to be a lot of problem that goes on around projects that are being executed is maintenance culture. So this is what we have already put in place in the club by inducting this and putting community corps in charge of that project. They will relay back to us, and at every point, at every time, we will continue to do what we know how to do best by maintaining what we have sunk money into in that hospital. You don't need to advise Rotary clubs for that. A lot of Rotary clubs have done so much in this country. Majority of the projects that you see that are laudable projects are done by various clubs in various districts all over Nigeria. So my advice is we'll continue to do what we know, how to do best. People of action, taking care of our communities, checking on what we need to do for people to be comfortable, because we understand that the government cannot do it all alone. That's why as humanitarians, as Rotarians, as people in the journey of selfless service, we are always glad and happy to go a long way, or one way or the other, touch lives, meet the needs of people. We do need assessments in all areas, in all clubs. There's no club that goes to implement any projects without finding out the needs of the people. They do needs assessments and all that. So all our advice is clubs should continue to do what they know how to do best, and it's not only the clubs, the district also are impacting lives, communities with major projects. I see it's one of the best things that has happened to Rotary, because a lot of people outside who are non-Rotarians have other ideas of what we do as Rotarians. But with this support that NCA 10 has given to us, it has given a global view and understanding to Rotarians and non-Rotarians. Even some people are Rotarians, but most of them, because they are new, they don't understand what Rotary stands for or represents. But as the news, the projects that they are helping us to project to the entire world, people are having a better understanding of what we do in Rotary, and they are connecting, and it gives us a new line to great memberships, because people are also joining Rotary through this media.
The project started from the year of Rotary and Kemi for Lauren Shaw. She was able to help us secure the approval, and as we all know, to get approval for such a kind of project, it takes a whole lot of time, because they want to be sure that whatever we are taking, or we are serious association to be able to take this. And then that's why the government that are involved, they took their time to ensure that we have the required resources and the wherewithal to be able to do it. However, immediately she left office, and then we secured the approval. Then I hit the ground running. We moved to site almost immediately. However, even at that, we still have to do a whole lot, because it took time for us to be able to settle down. But just to show some level of commitment, we moved to site to do the site preparation, and then we set every other thing in motion, and we're able to get some significant thing, because some of the equipment that will be used were bought during my year, and then some of the windows, but they were not able to install, because at the same time too, because we have to look for money, because a whole lot of projects, a humongous project, and we have to be able to give a lot of sensitization to different set of people to be able to convince them to say, okay, they are Rotarians, this is what we intend to do, and then we're able to tell them the impact of that particular project when it's fully completed. So, but at the point when I was leaving the office, we were able to secure a whole lot of, we were able to secure fund. We did a lot of fundraising, and then we were able to latch on some other things that we need to buy, because we find out that the inflation rate at that point is actually growing at an astronomical rate. So what we just need to do is just to say, okay, let us get some things right now and secure them. And at the same time, what we do at the same time is just to ensure that we have everything in proper perspective, to see that, okay, the next president, because we have actually targeted a 3-year project, which probably, because it's part of our strategic plan to ensure that it goes, because because of the money that is involved, we understand that it may be impossible for us to be able to raise that money at a single Rotary year. So what we have done is like, okay, we have looked at it and we faced the project. So at the end of the day, when I left the office, Rotary Alice Shuku continued exactly where I stopped, and then I was so amazed, because every hand was on deck, because we have the money, we have all the necessary resources that we are going to use to finish the project, and all the club members, I mean every individual member of RC Ikoyi Metro came on board, and every one of them made ensure that whatever activity they were given, and most especially the ones on the critical part, were ensured that they are completed. And a whole lot of kudos to my president. And I want to say today, I'm proud of him, and I'm proud to be part of Ikoyi Metro, because we have successfully implemented a 150 million project that actually cuts across about 4 areas of focus of Rotary, and that is going to impact from generation to generation, because we have we added about 41 beds to General Hospital Odon, and we have a whole lot of equipment that state-of-art equipment that is there, and then we added 11 million liters of treated water, because we have a tank, a stanchion tank, and a stanchion that carry about 6 different tanks, and the aggregate of all the tanks about 11 million liters, and with a water treatment plant that actually deals with disease prevention, because when the water is treated, then it actually stops some waterborne disease. I just want to say this is the way to go, and because like the Rotary president said, he said if you are doing a project and it's not making an impact, don't even do it at all. This is a project that we know that is going to impact from generation to generation, even generation yet unborn when they come. And we have made it a point of duty to ensure that from time to time, all the maintenance and ensure sustainability at that particular project is done, because we have set up the community core that will look at it and probably report back to us from time to time on what is required and how best we can actually manage the project better.
Well, for you to execute such a project, I mean, the project runs to the tune of 150 million. Definitely might be difficult for a club to do that in 1 year, because you need to raise funds to get it done. It will interest you to know that the project was done without any global grant. So for a club to do that, I mean, you might not just be able to raise funds to finish it in 1 year. Another thing is you might even have money, but you also need time to execute, depending on the scope of work. The project was conceived 3 Rotary years ago, let me just say 2023, 2024, during the time of Rotarian Adekemi Ololade Folorunso. She took her auntie to the hospital, and then she saw that people were being turned back. And of course, I mean, for a specialist hospital, for a hospital that has all the specialists you can think of, but cannot keep people, it's really will impact on the healthcare delivery. And that was what spurred us. She came back to the club, told us about the need in the hospital, more of a need assessment, and then the need for us to come in and, you know, refurbish the ward. They have wards, actually, C1, C2, F1, F2 upstairs, but they are all very, very dilapidated. And then we came into the picture to refurbish the ward. And not just to refurbish the ward, to also equip it with modern state-of-art medical equipment. And that's what we've done. We're talking of hospital that has space constraints, you know. We have the expertise, we have the specialists, but they don't have place to keep the patients. People are being turned back. In the course of moving patient from one place to the other, trying to look for another hospital to treat, to give them Medicare. You might lose them in the process. You know, we talk of mortality, morbidity, all the medical terms. You know, we might lose them in the process. Even if they don't, we don't lose them. We might have some delayed, you know, recovery. You know, by moving them from one place to another. You know, executing this project, or you know, make available 41 spaces, you know, bed spaces in the hospital. 41 spaces, bed spaces in a hospital that didn't have enough space is a whole lot. So that means you're able to keep 41 people at any point in time, treat them, and they recover and they get discharged. So it's going to improve, and then of course we have modern equipment, so it's going to help in healthcare delivery for the doctors. It's going to help in reducing mortality rates for people who are able to be kept there and treated. And then for the water, like we had during the commissioning, the water is potable water, not just any water. Water comes from the borehole, they are put in an aeration tank, they go through some basic treatment, filtration, and the UV to kill some bacteria, and then made available for use in the ward C1 and C2 and the wards nearby. So that again will help us to reduce, you know, waterborne diseases and things that could cause more problem or ailments for patients in the hospital. In equipping the ward C1 and ward C2, the club spent over 47 million just on equipping alone. Of course, the water, the wheelchair, also donated 5 wheelchairs and 5 crutches. Before we commissioned the project, we engaged the management of the hospital, because in Rotary, for something like this, we need to set up community call, you know, to look after what we have put in there, the project we've executed. So what we have done, we have 2 of our club members that we inducted in the course of the project. Rotary and Toyin, she works with, Toyin Ojo, she works with, she's a PA to the medical director. And then we also have a nurse, Fumi Oyemi. So first we requested for nurse Fumi to be posted to that ward. At least she's part of us. She will help us put an eye on all the equipment. Because apart from the beds, we have so many equipment, monitors and all that, that we bought for the hospital. So nurse Fumi has been redeployed to that, which is the good news. She's been redeployed to the ward. And of course, by being a member of Ikoyi Metro, she'll help us to keep an eye on some of those things. And then we also set up community call. Right now, we have 5 names. They were probably, you know, inducted, let me use that word, and we're looking for more names for us to register the community call under Rotary International. But that's the way we're going. We're setting up community call to look after every Rotary project. Because it's just one, we're going to be doing more collaboration with the hospital, and you know, we need community call to keep an eye. If anything is malfunctioning, or if any component, if anything fails, they are the ones to call our attention to it, and we'll come in to fix them. Well, this is my first time hearing of Rotary half hour, and of course, giving 30 minutes to Rotary to project, you know, what Rotary has done and what they are doing will help people to get to know more about Rotary. It will help people that want to partner with us. Because if you are the commissioning, some of our sponsors, we don't, yeah, you hear 150 million, but the 150 million is not coming from the club members. Somebody asked, why are you stressing your club members to bring money? I didn't stress any club member. The money came from different partners. And it's only somebody who trusts you that can give you money to execute project. Some of them came to see, and of course, you know, they recommended us. So if we did Rotary half hour, telling people about what Rotary is doing, people will trust Rotary more and want to commit their fund into touching lives and humanitarian services.
Okay, so Richard, what can you say about how excited are you? You know, the presidents are Francesco Arezzo and his spouse are visiting Nigeria. Well, you know how.
Yes. Well, I am excited. However, Rotary in Nigeria is a major force in the global community. And for as long as I can remember, a handful of years now, RI presidents often visit Nigeria. So we are happy to have the RI president coming. And not just coming this time around, the second Nigerian to be RI president is actually knocking on the door. The first being Jonathan Babatunde Majiagbe, who is now no more, from the Rotary Club of Kano. And in a few months, Adeyinka Babalola from Rotary Club of Trans-Amadi in Port Harcourt, South Nigeria, who will emerging, in fact, he is emerging as RI president. So that makes us extra excited. So,
you know, there are a couple of programs that's coming up that the Rotarians, Nigerians need to look out for, watch out for actually. So that's going to be like the dinner and dance, the peace summit, the president's visits, and so many more. They shouldn't miss it. Yes, tell our people not to miss it. A lot of
events. And you see, one thing you need to know about Rotary is that we change leaders every 12 months. And before you take office, Rotary will ensure that you are trained. Thank you so much for your time.
Thank you so much, Rotary Joe.
So, same time next week, we'll be with you again.